So this is the start of the neurological exam. I've already washed my hands and I'm going to introduce myself to the patient. My name is Shayna Mitchell. I'll be your nurse practitioner this evening. So first, before we get into the cranial nerves, I'm going to just assess the patient's overall appearance right now. The patient does not look like he's in any distress. For first assessment, we are going to look at the topic of the cranial nerves, and we are going to check the patient's nasal patency. I'm going to hold one side of your nose. I'm going to see if you can breathe in the other. Any difficulty?
No.
Any difficulty?
No.
Okay. So we have two different scents we're going to have the patient assess. The first scent is a perfume scent. And I want the patient to tell me if it's sweet or bitter.
Sweet.
And then we have another scent that's kind of strong. I want to let the patient tell me what he smells.
Strong. Menthol.
Okay. So the second scent was a menthol type scent, and the first one was a perfume type scent. Next, we're going to assess the patient's optic nerve. We're going to look at his visual acuity and we're going to stand in front of the patient. I'm going to put both of my hands on the patient's ears and then wiggle my fingers and bring the hands forward on one hand at a time until the patient can visualize. When can you visualize my hands?
No.
Okay. Nextly, we're going to assess the patient's optic fundi. We're going to see his vision.
No. No.
Okay. Go ahead and look at the pen for me. Look up. Look down. Look up. For our cranial nerve 2, which is our optic acuity and optic fundi that we assessed, we also looked at the patient's pupils. His pupils are round and equal and reactive to light, about 3 centimeters. As far as his reaction, when I was holding up the pen light and asking him to follow the pen light, he followed instructions correctly. There was no lag. For the patient's cranial nerve 3, 4, and 6, we're going to look at the trochlear, oculomotor, abducens, and some extraocular movements, which is what we did. But we're also going to do another assessment. I'm going to make a large H in the air, and I want the patient to be able to gaze. So by that, we're testing his convergence, and we just want him to follow our finger. So I'm going to make a H. Okay. For the cranial 5, for the trigeminal, the temporal and masseter, I'm going to place my hands over the patient's temporal and masseter muscles, and then I want him to clench so we can assess his level of contraction. Contract. Okay. For our sensory, although we assessed for his smell, we're going to assess his sensitivity to touch. So I'm just going to touch a few areas on his forehead, cheeks, and jaw with a wisp of like a cotton piece in random divisions, but I'm not going to stroke. So just tell me where you feel this.
No. 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 No.
Okay. As far as we did assess the patient's corneal reflex, approaching him from the side, and we'll do it one more time just to make sure.
No. No.
Okay. For cranial nerve 7, we're going to ask the patient to raise his eyebrows. Okay. Go ahead and give me a frown. Okay. Go ahead and close your eyes. Go ahead and show me your teeth. Go ahead and puff your cheeks. Okay. Cranial nerve 8, we're going to assess the patient's hearing. So we're going to do a finger rub together.
Yes. Yes.
I'm going to ask the patient, can you hear me?
Yes.
What did I say?
Still.
Okay. Now we're going to assess the patient's glossopharyngeal, which will be cranial nerve 9, and 10 for our vagal nerve. We're going to assess the patient's voice quality, and listen to the patient's voice. So we're going to ask the patient to open his mouth and say ah, and I'm going to look with the pen light at his soft palate and pharynx area. Go ahead and open your mouth.
Ah.
Say ah.
Ah.
Okay. If we had a tongue depressor, we would then assess the patient's gag reflex. We're going to assess some symmetry, deviation, and movement in the strength of the patient's tongue. Have him lift his tongue up, then protrude, and then move his tongue from side to side. In some ambiguous cases, we would have the patient do a tongue brush against the side of each cheek, and then we can actually palpate externally. So we'll do that first. So brush your tongue up against each cheek. And the other. Okay. Go ahead and open your mouth. Lift your tongue up. Lift your tongue down. Okay. As far as the patient's coordination, we're going to assess his upper extremity on his thigh area. We're going to strike a hand on his thigh, and then do an alternating strike with the back of our hand. So the patient should do this rapidly. So basically you're going to go. Okay. As far as the gait, now we're going to have the patient stand up. Walk towards me. The patient is walking with an erect posture. Turn around, walk back. All right, and we're going to have the patient stand on his toes and on your heels. And then we're going to have the patient hop in one place. Okay. As far as the stance, we're going to test the Romberg and pronator drift. With the Romberg, go ahead and face towards me. The patient stands with his feet together and his eyes closed. And we're just assessing if the patient is able to maintain an upright posture without swaying. And he is able to maintain a posture without swaying. And now we're going to assess our pronator drift. So the patient is going to stand with both arms outstretched and his palms up. Palms up. And your eyes closed for 30 seconds. And then he's going to gently lower his arms downward. And so now we're just going to assist this for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, go ahead and roll your arms. We're going to assess the muscle tone of our patient, looking for any resistance to passive stretching on his upper and lower extremities. So we're going to grasp his hand, support the patient's elbows. Go ahead and squeeze my fingers as hard as you can. Okay. Go ahead and flex your elbows. Okay. Go ahead and push against me. Push against me. And pull against me. Okay. Now we're going to also have the patient place one hand on his thigh and then grasp his foot with the other hand. One hand on your thigh, grasp your foot with the other hand. One hand on your thigh. Okay. So when we do this exam, it will be one hand here and then grasp here. Okay?
Okay.
One hand here and grasp. So we did look at the flexion and extension of his elbows. We're going to ask the patient to make a fist in front of us, and we're going to show you guys so he can just press down. Make a fist. Go ahead and move back just a little bit. Okay, and I'm going to try to push down. Okay, and I'm going to try to push up. Okay. We did assess his grip strength. We're going to look at his finger abduction. So go ahead and spread your arms. Spread your fingers wide apart and then close them. Okay. Go ahead and have a seat for me. We've already assessed the patient's flexion and extension when he placed his hand over his thigh. Now with the patient seating and his legs relaxed, we're going to assess his hip abduction and adduction. So we're going to place our hands on the lateral aspect of both of his knees and offer resistance to further abduct. Relax. No, resistance. So you stay here. Okay. Resistance. Okay. Again, with the patient sitting, he's going to place his hands on his shins. Go ahead and place your hands on your shins. And we're going to have the patient to straighten his knee against resistance. Okay. As far as ankles, we're going to ask the patient to press down like a gas pedal and then ask him to pull up against resistance. So go ahead and sit back. Press down on my fingers. And pull up. Okay. For our sensory system, we're just testing for light touch to see if there's any painful nociceptor areas or proprioceptor areas that the patient may be sensitive to. We're going to stroke against with a piece of cotton. We're going to do the patient's hands. Are you able to feel this?
Yes. 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 Yes.
Okay. Next, so we're going to assess the pace. We did assess the pace of the testing, so the patient wasn't able to really anticipate any movements. So his stimuli responded positively in this sense to the areas that we wanted to be tested, rather than being in a predictable manner. As far as his symmetry of comparison on both sides, patient's areas of the shoulders, his forearms, thumbs, his fingers, and both thighs are all symmetrical. I'm going to put my hands on the patient's shoulders. Go ahead and shrug, and then look left to right. Okay, relax. Lastly, we're going to assess and see if the patient can test us for additional pain. What we're looking for is to see if he can tell us if he feels a warm or cold sensation. So what we have tested is like a coaster piece, and we'll do this hot coffee. So we'll just pretend. Okay. Hot or cold?
Cold.
And then hot or warm?
Warm.
Okay. Again, so we assessed the proprioception of the patient. And we also grasped his greater toe and held it by its side. The toe did move up and down several times. That part, you guys, we can't really visualize on the camera, but we were doing it when we were assessing him, pressing down on my hands and pressing up against my hands. As far as any vibration, we're going to take a close look at the patient's eyes. If we had a tuning fork, what we would do is place it over the distal interphalangeal joint of the finger, as well as the interphalangeal joint of the great toe. And we would just ask the patient to state when he stopped hearing the vibration. So unfortunately, we do not have that instrument with us at this time. For any discriminative sensations as far as stereognosis, we are identifying an object by feeling it. So I'm just going to have this perfume bottle that we had. Tell me how this feels. The shape, temperature.
Square, cold.
Texture.
Smooth.
Is it like plastic? Is it like
glass?
Okay. Thank you. Next, the graphesthesia. We're basically I have the patient identify a number that is being drawn in the palm of his hand with the tip of a pen. So go ahead and lift your hand up so the camera can see. And which number am I drawing?
2.
Good job. Now we're going to do a 2-point discrimination. Find a distance where 1 point is touched, where 1 point of touch is perceived when 2 points of pressure are applied. So go ahead and lift your arms up again. Give me your hand. Do you feel, just have your stay just like that. Do you feel 1 touch or 2?
1, 2, 1, 1, 2, 2, 1, 1, 2.
Okay. As far as point localization, we're going to have the patient close his eyes, and we're going to touch the patient's body, and then we're going to have the patient open his eyes and point to us where he was touched. Go ahead and close your eyes. Where were you touched? You can open your eyes.
My heart.
Show me. Okay. Now we're going to assess his extinction. So simultaneously touch corresponding areas and ask the patient where he felt he was touched at. So close your eyes. Tell me where you were touched at. Open your eyes. Okay. Lastly, for any deep tendon reflexes, we're going to assess the patient's biceps. We're going to have the patient flex his arms, palms down, to assess his biceps. Flex your arms. Are you flexing? Okay. Okay. And then last, for our meningeal sign, we did assess the patient's neck mobility. The Burdinsky sign, we're going to look and see for a neck flexion and a flexion of hips and knees. And the Kernick sign will be flexing the leg at the hip and knee in the straight leg, which we looked at those earlier when we were assessing the patient's motor function as well. Additionally, if we had if we were looking for assessing the patient's knee jerk, we would tap the patellar just below the patellar tendon, just below the patella. And then for the ankle jerk, we would hold the patient's foot in sight and dorsal flex and then strike the Achilles tendon. So unfortunately, we don't have that. The patient isn't sitting on an actual exam chair for us to see that, but that's just an explanation of what we would do. As always, when performing these videos, we don't have patient is adequately clothed, but we have maintained exposing the patient on camera for privacy purposes. Thank you for this exam.